the most number of robotic surgeons, experts who are practicing.
Board-certified, trained colorectal surgeon.
St. Luke's Medical Center has a very strong track record in performing robotic surgeries.
We have the facility to handle robotic colorectal surgery here in St. Luke's.
I'm Dr. Hermogenes Monroy III. I'm a colorectal surgeon. I'm currently the head of the Institute of Surgery here in St. Luke Medical Center, Global City. So I've been doing robotic-assisted colorectal surgery since 2019.
I am Dr. Gilmyr Jude Marañon. I am a colorectal surgeon. I practice in both St. Luke's Medical Center, Quezon City, and Global City.
I am Dr. Romulo Cabantac III, a colorectal surgeon, practicing both here in St. Luke, Global City, and St. Luke's, Quezon City.
I'm Dr. Andrei Abella. I'm a colorectal surgeon and I practice both in Global City and Quezon City. Robotic surgery is a type of minimally invasive surgery using another platform. We have the laparoscopic platform and the robotic platform. So main advantage, patient outcome, like easy return to work, minimal incision, less pain, and better incisions. Because of bigger incisions, complications like adhesions, nagdidikit-dikit yung bituka, the tissue handling is different from that of minimally invasive.
Now, with regards to surgeon factors, is an advantage of the robotic over laparoscopy is the comfort level that robotic surgery offers to the surgeon. And if we're dealing especially for cancer, is oncologic outcomes. No recurrences, good recovery nila.
It enhances dexterity. Because of the 3D magnification of robotic surgery, it has better visualization. You will be able to zoom in towards that confined space. You will have also proper lighting compared to an open surgery wherein you will have to adjust your operating room lights in order for it to be directed towards the pelvis. The instruments mimic the human hands with full range of motion. Compared to laparoscopic, the instruments are rigid. You will be able to see the tissue planes properly, and because of the good articulation, you will be able to dissect these spaces properly.
Robotic-assisted colorectal surgery is the most advanced, minimally invasive approach. But the instruments of robotics can articulate or bend at the tip. Just like your human hands, it can move in all directions. We did a local study in St. Luke's. We compared open, laparoscopic, and robotic. There's really an advantage. Shorter hospital stay, less complications, lower conversion. Because when you do laparoscopy, sometimes if the procedure is very difficult, you convert to open.
It's three-dimensional. Unlike the in laparoscopic procedure, it's two-dimensional, so you cannot see beyond. Although there are some laparoscopic platforms that are 3D, but you're gonna have to wear 3D glasses.
For laparoscopic surgery, the surgeon is within the surgical field, nakatayo, and a lot of factors affect the decision-making of the surgeon during the surgery. So pinakauna doon is kung extensive yung surgery, napapagod yung doctor, it will definitely affect the decision-making. Comparing to robotic, the surgeon is outside the surgical field and nandun siya sa console. Very comfortable yung doctor, mainly because nakaupo siya. At the same time, the decision-making, intraoperative decision-making is better because the doctor can actually stop in between the surgeon to recollect kung may nakikita siyang kakaiba, hindi na niya maintindihan yung nangyari, he can actually stop without affecting the surgical field.
Recovery time is much faster compared to open. That's because of the very small incisions also being done. And aside from that, because of the less manipulation of the bowels or the organs, the patient has prone to have lesser ileus, faster bowel function. There's also a decreased risk of surgical site infection. It's very much beneficial for complex types of cases. Organs affected which are confined in the pelvis, like for example, in our case, the rectum. Robotic instruments will be able to access the confined spaces and be able to dissect that area with much accuracy and precision.
Patients who have a very thick abdominal wall, from skin to the fascia to the muscle, you'll have a very deep wound. The main reason why there's a higher infection rate in open surgery, we call it ill use or being unable to function after surgery, higher incidence in open compared to minimally invasive surgery. So the benefits of smaller wounds, no exposure of your organs and intestine, the faster recovery, healing, lesser incidence of infection, being able to do more complex surgery than laparoscopic.
St. Luke's Medical Center has a very strong track record in performing robotic surgeries because they have been performing this for several years. It's one of the pioneers, robotic surgery. We foster multidisciplinary collaborations among different services for very complex surgeries which involve other specialties.
The surgeries are done by experts, board-certified colorectal surgeons who are trained in a colorectal training program. The outcome becomes better because they know how to manage it. They know what are the patients will really benefit in robotic surgery. That is what St. Luke's is trying to offer to our patients.
St. Luke's has the most experienced robotic surgeons and have been excellent outcomes that we have published and documented and assured that you'll be handled by the best robotic surgeons in the country.
St. Luke's would have the most numbers of robotic colorectal surgery. We have the expertise. We have the facility to handle robotic colorectal surgery.
That's why St. Luke's Medical Center continues to lead the way in robotic-assisted colorectal surgery in the Philippines, delivering world-class care, faster recovery, and better surgical outcomes for every patient.